Hi everybody, I am Dr. Pradeep Kumar Shenoy, nation's first DNB rheumatologist and consultant rheumatologist at Amrita Multi-Specialty Clinic, addressing you from my clinic. This is situated opposite to KMC Attawar and next to Chakrapani Temple in Mangalore. In this video, we will look into the spectrum of rheumatic diseases or the most common cases that we see in our clinical practice. I will start with the skin. We see systemic sclerosis, which is again divided into diffuse cutaneous and limited cutaneous. Then there are diseases like systemic lupus erythematosus, MCTD, that is mixed connective tissue disease, UCTD, which stands for undifferentiated connective tissue diseases, and sarcoidosis. Then let us go into the muscle disorders. There are muscle disorders like polymyositis, dermatomyositis, inclusion body myositis, etc. Let us go to the blood vessels. There are three types of vasculitis, that is large vessel, medium vessel, and small vessels. Large vessel vasculitis are tracheosus arthritis and giant cell arthritis, which is associated with the polymyalgia rheumatica. Medium vessel vasculitis is polyarthritis nodosa, that is a classical pan, and Kawasaki disease. Small vessel diseases are granulomatosis with the polyangiitis, eosinophilic granulomatosis with the polyangiitis, henoch-Schönlein purpura, and microscopic polyangiitis. Now, coming to the bone, we mainly encounter osteoporosis and rarely encounter metabolic bone disease, including hyperparathyroidism. And in our clinical practice, we see a lot of pain syndromes, that is abnormal pain processing by the body, which includes fibromyalgia, myofascial pain syndrome, post-infectious arthralgia, myalgia, and chronic fatigue syndrome. We see also hypothyroidism with aches and pains and carpal tunnel syndrome. And sometimes we see diabetes with peripheral neuropathy or Sudex dystrophy and osteomyelitis. And you'll be surprised to know that we see Parkinson's disease in our clinic. This will be an elderly gentleman with aches and pains and stiffness of the joints. The stiffness is because of the rigidity of the joints, and this causes some amount of pain also. As somebody ages, the possibility of rheumatoid factor becoming positive increases, and there is a formula to calculate the maximum ESR for an individual. In men, it is age by 2. In women, it is age plus 10 by 2. So as the age advances, ESR also increases. And when we see the patient, there will be stiffness. We think that it is because of the arthritis. Then we look at the wrist and examine for rigidity. Then there will be cogwheel rigidity, because before that we would have looked at the face and picked up mask-like face. So this confirms Parkinson's disease. But as the age advances, as I already mentioned, rheumatoid factor could be positive. Now, anti-CCP is the one which comes for our rescue. If anti-CCP is negative and rheumatoid factor is positive, and if he has got all other features of Parkinson's disease, it is Parkinson's disease. Now, coming to rheumatoid arthritis, we have spectrum of diseases, that is articular and extra-articular manifestations that we see in the clinic. Last but not the least, osteoarthritis. Many elderly ladies, that is 55-year-old ladies in and around, postmenopausal obese ladies coming with osteoarthritis. And there is a battery of spondylitis, which includes reactive arthritis, ankylosing spondylitis, psoriatic arthritis, and enteropathic arthritis. Then again, there are crystal arthropathies like gout and pseudo gout. In rheumatological practice, there are a lot of illnesses which are beginning to be discovered. I am sure that I am almost complete, but not fully done. The criteria laid down by American College of Rheumatology is to create a homogeneous population for clinical trials. The criteria laid down by American College of Rheumatology should not be used for clinical practice. For clinical practice, one should know or have a homunculus representation of natural history of each and every rheumatic illnesses in his brain. Only then clinical practice is possible. Now, sometimes we'll end up with an ambiguous case. I will tell you, for example, I had a lady who was 24 years old. She had diffuse aches and pains, and which was of 4 months duration. When she came to my clinic, I examined her in toto. She had tender points of fibromyalgia, but there were no arthritis. Then I looked her into a soft palate. There were no ulcers. So I told her that let us do some blood test. So her ANA was positive and all other tests were normal. Even C4 was normal. So I kept her under follow up. I told her that you should meet an ophthalmologist, cardiologist, pulmonologist, and nephrologist every 4 months and make sure that your vital organs are safe and sound. So I started her on HCQS and other drugs for fibromyalgia like pregabalin. So she used to consume these medications and she was symptomatically better. And every 4 months, after consulting these consultants, she used to come and tell me that everything is okay, sir. So this went on for 2 years. At the end of 2 years, she said that she's having hair fall. When I examined, she had scarring alopecia. Then I looked at her soft palate, she had an ulcer there. Then I checked her C4, it was low. Then I was surprised to see that her leukocytes were low. So this almost confirmed the diagnosis of SLE. I started her on hydroxychloroquine. I continued. I started her on steroids and azathioprine or mycophenolate mofetil, which I absolutely don't remember. So, ambiguous case in rheumatology practice requires long-term follow-up. Only then we can come to a correct diagnosis. Especially fibromyalgia is a diagnosis of exclusion. There are a lot of fibromyalgia mimickers. So we have to rule out all those conditions by doing blood test. Only then we can conclude that it is fibromyalgia. Along with fibromyalgia, there can be migraine, irritable bowel syndrome, irritable bladder syndrome, menstrual disturbances, etc. So, among the pain syndromes, fibromyalgia I have quoted as a prototype. About pain syndrome as a whole, we will discuss some other time. Thank you.